We begin, though, in what was overall a very difficult weekend for the United States in the ongoing fight against the coronavirus. The new wave is taxing hospital emergency rooms again, with the health officials warning things could get a lot worse. NBC political correspondent Vaughn Hilliard has more.
The United States topping 100,000 new coronavirus cases just Friday, a stunning fourth wave, with the number of infections and seriousness of the moment rising each day.
Things are going to get worse. If you look at the acceleration of the number of cases, the 7-day average has gone up substantially.
The virus surging in states from the west to the east, cases doubling in more than 40 of them over the last 2 weeks.
This is a Class 5 hurricane.
More Florida residents tested positive for COVID this weekend than at any other point during the pandemic. Hospitals in Jacksonville and Orlando are already breaking previous hospitalization records. In neighboring Alabama, more than 1,200 people are currently hospitalized, and COVID unit doctors say August will be even worse.
The number of cases by Labor Day will be more than twice the number of cases we saw at the worst time in January. That's what we're about to face, and the public isn't ready for that.
And in Texas, overwhelmed hospitals struggling to hire additional nurses and staff.
They're not finding the uptake, even dramatically increasing the pay they pay.
40% of the country is still not fully vaccinated, and those individuals are making up more than 90% of COVID hospitalizations, forcing hospitals today to build out new COVID units. This one in Baton Rouge.
In the last 24 hours, we opened up our fourth COVID ICU because of the surge of patients requiring critical care. Younger and sicker quicker. They're just getting sick very quickly.
Among the 100 million unvaccinated, some encouraging news. Vaccination rates doubling this week in several hotspots.
This may be a tipping point for those who have been hesitant to say, okay, it's time.
A small town in Massachusetts has become one of the country's biggest Delta variant hotspots, but it is also direct evidence the vaccine is keeping people safe. A CDC study released on Friday cited a cluster of new cases in Provincetown as a key factor in its decision to issue new indoor mask guidance. Less than 2 weeks after a busy 4th of July weekend, the town's COVID-19 positivity rate reached 15%. The New York Times says most of the new cases came from men who had made doctor's appointments for other reasons and were surprised by their positive tests. That's because 74% of those patients were fully vaccinated, according to the CDC. Of those infected, the CDC says few became seriously ill. No deaths were reported, and just 7 people were hospitalized. And in the case for the vaccines is evidence in the national numbers. Look at this. Overall, 99.9% of vaccinated Americans have not tested positive, and 0.001% of vaccinated Americans have died from the virus. These numbers should help people along, people who are struggling with the science of this. These numbers are proving the vaccines can keep you alive. If the numbers don't convince people, the individual stories might. For example, 55 days on a ventilator alone might change the way you view COVID. And that's exactly what happened to one Tennessee lawmaker. Back in June of 2020, state lawmaker, Republican David Byrd, accused the, quote, mainstream media of sensationalizing the pandemic and later attended a multi-day retreat without masks amid surging infections. But on Friday, after a bruising bout with coronavirus, he acknowledged that COVID is, quote, a disease that wants to kill us. As the Washington Post reports, his illness ravaged his memory, muscles, and organs and led him to having a liver transplant. This is just one of the many stories emerging about those who regret not being vaccinated. A new piece for the New York Times is documenting how people who once rejected the vaccine or simply waited too long are now grappling with the consequences. Among them, Utah's Mindy Green, who says she read all kinds of things about the vaccine and was scared Her husband, however, fell victim to the virus and was put on life support. Green posted on Facebook, quote, "If I had the information I have today, we would have gotten vaccinated." And this tragic story out of Las Vegas, where a father of 5 spent one of his final moments sending this text message from the hospital. "Oh my blanking God, this is terrible. I should have gotten the damn vaccine." Michael Freedy died on Thursday. His widow says, quote, "My kids don't have a dad anymore because we hesitated. I would take a bad reaction to the vaccine over having to bury my husband. I would take that any day." There is some good news in all of this. In areas where the Delta variant is surging, vaccination rates are going up. People are hearing the message. In the past 2 weeks, at least 4.7 million Americans have been vaccinated. According to the Washington Post's vaccine tracker, more than 856,000 doses were administered on Friday, the highest daily figure since July 3rd. Many of the new vaccinations are taking place in COVID hotspots. On Friday, multiple media outlets reported that Louisiana had seen a 114% increase in vaccinations. Arkansas saw a 96% increase. Alabama saw a 65% increase. And Missouri had a 49% increase. Another report now from NBC's Vaughn Hilliard on the rising rate of vaccinations across the country.
The country's hottest infection spots this month are now also leading the country in new vaccinations.
That was the time.
Across the U.S., a 31% jump this week in first doses administered. Some of the states most responsible, places like Georgia, Missouri, and Texas, those with the country's lowest vaccination rates. With the Delta variant sweeping through, doctors began pleading.
We really need your help to help us.
And Republican governors taking a louder stand.
It's time to start blaming the unvaccinated folks.
Now, data showing progress this weekend. In Alabama, vaccinations are up 159% compared to 3 weeks ago. And Florida, up 78%. A local pharmacist in Delwood, Missouri, encouraged by the new demand.
I can comfortably say it's gone up by at least 50% now from where it was end of June.
But why now? What took you these many months to finally decide to get the shot?
Because I saw the cases are rising. Because I've seen more people of my family and friends have taken it and they're okay.
One entire family in St. Louis decided to roll up their sleeves before school starts.
I wanted to get the shot because I wanted to protect myself and I also wanted to protect other people.
We do know some that are close that have passed.
In some states, offering $100 with the shot.
The more I research about it, the pros outweigh the cons, so that's why I decided to get it.
And an urgent push from the FDA saying it's all hands on deck as it works to formally approve the Pfizer vaccine, elevating it from its current emergency use status.
If that means that additional people will feel comfortable getting vaccinated, I think that's a good outcome.
Florida is quickly becoming the epicenter of this fourth wave of infections, accounting for about a fifth of all the new cases in the U.S. Yesterday, the state broke a previous record for current hospitalizations set more than a year ago before vaccines were available. Hospitals across the state are once again becoming overwhelmed. In Jacksonville, for instance, hospitals have more COVID patients than ever before, despite the availability of vaccines. The New York Times spoke to healthcare workers in Florida who feel a sense of disbelief that they must endure another surge. One nurse said, "We are scared of seeing what we saw, and this time affecting the younger population. This is the hardest thing I've ever done in my entire career." Another nurse told the Times, quote, "It is the worst feeling ever. When you watch someone looking at you like, I can't breathe, help me." And that's the worst image that I have in my mind, and I never forget it. A recent survey conducted by the Florida Hospital Association found 96% of hospitalized COVID patients are unvaccinated.